This news feature is a collaboration between the Government of Belize, the Ministry of Health and Wellness, the Embassy of Japan, and UNICEF. COVID-19 put a tremendous strain on Belize's health system, stretching human resources and effectively splitting Belize's healthcare services in two: those offering limited services to non-COVID-19 patients and those tasked with covering respiratory clinics and isolation wards. And as the pandemic winds down, one notable negative side effect that has persisted is reduced access to regular vaccines for the youngest among us. We heard more about this problem and its possible solution from the technical advisor in maternal and child health, Dr. Natalia Baer.
We are seeing a decrease in the uptake of the vaccine, the regular, but it's an effect of the COVID-19 where people fear to come to the health facilities. But we are reaching out to the communities, inviting them back to the facilities and ensuring to them that because of the numbers that are low, it is safe now to come back again and receive the vaccines at the facilities.
And to support those efforts, a new partnership between the Government of Belize, the Ministry of Health and Wellness, the Embassy of Japan, and UNICEF is seeking to strengthen primary healthcare delivery through a $900,000 donation to Belize. Through technical support and capacity building of health workers, UNICEF and Japan are supporting our health sector to build back better.
We have a unit that we recently established with one medical officer per hospital, dedicated full-time to follow through with the processes, to look at the gaps and address those gaps with the local teams to improve the quality of services. Routine auto monitoring of their services that they are providing through clinical audits and training of the staff. Improving updating the guidelines that we work with, and activities related to quality improvement. Well, yes, we do focus on skills development. We're starting off with maternal and neonatal care services, but eventually we'll expand to the other technical areas.
And that capacity building follows UNICEF's Reimagine agenda, which seeks to strengthen Belize's health systems to make them more efficient, resilient, and future-proofed against the next possible pandemic. That's why UNICEF, through the support of the Government of Japan, is mobilizing resources to support national health goals. But that all starts with the message that when delivered properly, vaccines work, and vaccines save lives. And while she's overseeing the development of skills in maternal, neonatal, and other services, Dr. Baer is also working hand-in-hand with UNICEF for the maintenance of Belize's vaccine cold chain.
We are grateful to the government of Japan, the people of Japan, and UNICEF for their support. We definitely have one goal in common, which is to improve the access and the quality of services to the population. And we invite everyone, to come and receive the services that the Ministry of Health and Wellness is offering, preventive and curative services.
For UNICEF and the Government of Japan, it's the last leg of this region's essential journey to rebuild health systems and to recover from the pandemic. This news feature is a collaboration between the Government of Belize, the Ministry of Health and Wellness, the Embassy of Japan, and UNICEF.